this next one is, my question has to do with parents with an adoptive child with insecure attachment and or attachment disorders. That is when, oh, I'm sorry, that is then manipulated by the other parent in a contentious divorce through a parental alienation. Okay, we are going to be getting into something that is with parental alienation that tends to be something that's brought up in court a lot in custody issues. I specifically would like information about the likelihood that the alienated child can never possibly recover once severe alienation occurs. I have not found any pertinent information anywhere about these two disorders, in quotation marks, overlapping. FYI, parent alienation occurs when a pathological parent uses the child to gain advantage and develops an unhealthy alliance with the child, inducing psychological splitting in the child. This is done solely to hurt or punish the other parent. Family courts and all court-related therapists have zero training in such matters, so obtaining court-ordered therapy is highly unlikely. I feel like I can't be the only parent in this predicament. I am also the adoptive mother, and most, but not all, of my child's behaviors prior to the divorce were as directed at me as a former primary caretaker. Some were also directed at her sibling, rejection of the adoptive mom, and divorce. Okay, this one's loaded, just loaded to the hilt, because not only do you have a child who's adopted,
Yes.
who also has some abandonment, some loss, some separation issues, okay? And then there's a parent who leaves the family structure, which also is difficult. I don't care how good or bad that relationship
Amicable.
is, it still is a loss for that child and will bring up other grief issues. Also, you have a court battle going on, apparently, and you have a parent who is splitting. And so this child is put in the middle of this very contentious relationship between the parents. So this child needs their own therapist. They also need to do a parent-child intervention with the both parents and the child, with a trained person who does those. Not every therapist knows how to do a parent-child interaction. Okay, so usually it's an attorney, or it's a psychologist, are usually the ones who do those. So I would, if that has not been done in this case, I would go ahead and seek that help out.
Do the CFIs do that also?
Yes.
Okay.
Yeah. Anything you want to add?
A few things, yes. There has to be a want or a buy-in on the part of each of these family members and the child to want to address the issues. And because of the nature of the grief and loss, the individuals are not likely prone to want to address it. So there has to be a buy-in to begin with. They have to want to do that. And if that's not there, then you don't have your foundation or your baseline to move forward. So there has to be a buy-in. There may be a need for psychiatric evaluation. There may be a need for a psychological evaluation. We don't actually know if this predicament, this is one side of the predicament presented to us, so we don't know all the factors here. There are such things as EMDR, eye movement desensitization and reprocessing for post-traumatic stress disorder, which looks like we have post-traumatic stress disorder symptoms described here. There is somatic experiencing to move trauma through the body. There's now brain spotting, which is another therapeutic approach. So there are many different directions to explore, but they are out there. So, but the critical piece is there has to be a buy-in and a want, to address it. So.